people connected.
Research on epilepsy in Africa is a big challenge for us, and especially in the field of epilepsy. What is research? Research is a scientific investigation for knowledge production. So there is the aim of the research is to contribute to the literature, is to improve clinical practice, and research should be helpful for the community and also for advocacy. So when you go to PubMed and you click epilepsy in Africa, you will see that since 1959, Africa has produced 1,651 paper on PubMed on epilepsy. And when you go deep inside, you will see that per year the number is increasing. As you can see, in 1959, only one paper was published on PubMed, and now nowadays we have around more than 100 paper published per year in PubMed. So when you compare it with research on epilepsy in the world, you will see that you have 153,000 paper published on epilepsy. So that means what? With more than 10% of patients with epilepsy, Africa contribute to only 1% of papers of research in the field of epilepsy. So there is a great gap between the resources and the research paper. But you know that PubMed is not the only research tool for paper. In Africa, we have also journals that are not on PubMed, but are also source of information in the research concerning epilepsy. What are the challenges? The challenges, one of the main challenges is the scarcity of epilepsy specialists. There are a few neurologists in Africa. The number is increasing actually, but there is still a need of more neurologists, more epileptologists, and more specialists of trained nurse on the field of epilepsy. There is a poor availability or access to diagnostic facilities and treatment. In Africa, we have a treatment gap where more than 80% are not on treatment or are not controlled on treatment. So we have also a pure community knowledge about epilepsy-related issue and stigma. So that is one of the important points, especially for Epilepsy Africa Alliance. There is a need of more information about psychosocial and psychosocial consequences of epilepsy and stigma on patient epilepsy. We need more data, so we need to do more research on this field. There is also a societal and cultural barrier, and only some of the issue contributing to this deficiency. And also one of the important limitation is the financial limitation and lack of sponsorship. You may know that in Africa there are very few countries where the government sponsor research, especially research in the field of epilepsy, and also where university sponsor research. So there is a great need of finance or funding to go deep into into research. To illustrate the lack of epilepsy specialists, I've taken this paper of Volde Manuel and Girma published in 2014 that assessed the number of physicians or specialists in the field of epilepsy, and you may see that there is a huge scarcity of neurologists, neurosurgeon, diagnose. There is a lack in diagnosis tool, AEG machine, especially CT scan and MRI machine. So there is a huge need of diagnosis tools in Africa. So what are the opportunities of research on epilepsy in Africa? One of the main opportunities is our patient. We have we have many patients. For example, in my consultation, there is no day in my consultation where I don't see a patient with epilepsy. So we have resources for research, especially patient. There are still different features of epilepsy that need to be explored. Like I told you, psychosocial consideration, stigma consideration need to be explored. We have also clinical features. As you may know, there are now two epilepsy-associated conditions discovered in Africa, onchocerciasis-associated epilepsy and Nodging syndrome. So I think if we go deep into research, we may find other type of epilepsy. There is also the field of treatment. We have local plant, we have concoction, we have African pharmacopea. That is one of the field which has not been well developed in research. So there is also the field of genetic, and there is almost nothing about genetic in especially sub-Saharan Africa, genetic of epilepsy. That's why in our different research paper, sometimes we don't even mention the genetic aspect of epilepsy, the genetic causes of epilepsy. But when you compare it to what is done in the rest of the world, especially in developed country, we can see that there are many genetic related epilepsy that have been discovered. So in Africa, we still need to go deep into research of genetic causes of epilepsy. I know that to go deep into genetic, we need more material, we need molecular biology. So that's why it is also important to advocate on epilepsy, to advocate on the need of equipment, on the need of diagnostics tools to help conduct good research and publish good paper in the field of epilepsy. So this is my last slide. It's just to encourage all of us. Epilepsy is one of the field of great interest, especially in Africa. We have the patient, and we have the patient, and also we have the how can I say it? We have the fighting spirit. So let's work together and try to publish and contribute to research as much as possible. So thank you. Thank you.
Thank you. Thank you very much, Dr. Gams Massi from Cameroon, for a wonderful presentation. I'll now ask participants if they've got questions for Dr. Massi. We'll take 2 questions at this moment. You can also post your questions in the discussion forum. Then also prepare questions to ask at the end of the, towards the end of the webinar. I've got a question for you, Dr. Massi. Thank you so much for a brilliant presentation tackling issues to do with epilepsy research in Africa. I'll be saying more about that as well, but I'm interested in your ideas about doing research that is helpful to the community. I think you said that in your first or second slide. I think that's very important for Africa. In your opinion, how best can we, or what can we do to ensure that the research that we do it benefits the communities that we work with, it benefits people with epilepsy, and it is used by governments. We don't just want to research and put the research in the libraries without that knowledge being translated into policy or action. What are your views on that, Dr. Massi?
Thank you, Jacob, for this question. I agree with you. Research should be helpful for the community. For me, it's one of the main goals of research. And in my opinion, research should be, for example, research question should be focused on the problem, on our problem, local problem. For example, there is a huge need to contribute to change in the psychosocial perception of epilepsy in most countries, in most African countries. There's a huge need to change the cultural perception of epilepsy in most African countries. And this, to address this, we need to have data. To have data, and also to present, to advocate for it, we need to have data. So that's why we have to focus our research on our local problem before going further. As you have seen in my presentation, genetic comes only in the last slide. So I think for now, regarding our environment, it will be difficult for us to go deep into genetic research, but we have our local problem, we have our local interest that may be helpful to address before going in another step.
Thank you. Thank you
I have
very
one
much.
question for Dr. Gams.
Yes, please go ahead.
Yeah, so Dr. Gams, I think it's a very interesting talk, and I think myself, I'm very enthusiastic and I'm very happy to collaborate in this group. And I think we have a lot of productivity starting now. I think, as we discussed since the first webinar, to develop some subgroups of research. And I think Dr. Gams is one of the active members. So my question for Dr. Gams is, how do you see the collaboration, the multi-centric collaboration in order to produce research and to publish papers? Because I think we have one strong opportunity is to give, by example, in any topic, by example, anti-epileptic medications or maybe stigma or any other topic. I think if we reach to have one representative per country, I think we'll be very strong and we'll have good confidentiality, and we can produce many papers. What do you think about the collaborative works? Because it does not cost a lot of money, like genetics or other equipments. And I think we just need to have one questionnaire to be circulated, to have one representative in each country, and we can sort out a lot of interesting papers for the African Middle East Epilepsy Journal, or maybe the index journal like Epilepsy and Behavior.
Yeah, Professor, that's one of interesting question, and I thank you for the question. I also thank you for your engagement in the research in epilepsy and also in neurology. I work with you, and you are an amazing researcher. You are a hard worker, so I thank you for that. I think this is one of the main point, the collaboration in the field of research in Africa. I think you have set up a good research network that need to be reinforced. Especially when you are talking about representative in any African country. There is a need for a representative in any African country. There is a need for more collaboration. There is a need of also more complementary field, because I think in Africa is not only epilepsy is not only the problem of neurologist or neurosurgeon or health worker. Epilepsy is a social problem, is a cultural problem, is an economic problem. So we need to be able to involve all these fields. So social specialists, cultural specialists, etc., to have to be sure that we cover all the aspects, all the feature of epilepsy in Africa. So I agree with you. We need to reinforce our collaboration, and I'm available for that.